Hey, Mr. D. My name is Diliah Stinson, and I am in nursing school at the University of South Alabama in Mobile. Today, I will be assessing your respiratory system, okay?
Yes, ma'am.
So during this assessment, I'll have to use my pen light to look into your mouth. I'll have to use my stethoscope to auscultate your breath sounds.
Okay.
And I'll possibly palpate and touch you. Is that okay?
That's fine.
Is it okay that you are being recorded?
I can see it.
Okay. Ms. Sherry, will you please scan the room? So for your respiratory system, you know, the normal for an adult is 12 to 20 breaths, okay, per minute. Now, we also have to assess whether it's regular, your breathing is regular, or if it's irregular, if you're using your accessory muscles to breathe, whether it is shallow, which is like a slow rise and fall to your chest area, or if it's moderate, which is regular, and if it's deep, then that means you could possibly have some respiratory issues going on, okay? So I'm gonna ask you to stand, and I'm gonna take off your gown, okay? We're just gonna take a look. All right, so we're just gonna take a look at your overall chest area. We're looking at your hair, which is coarse on the anterior and on the posterior. It just has hair scattered throughout, no lesions, no scars on the front or the anterior or the posterior part of your chest. Your color looks like it's equal in your hands. Okay, we're gonna also look at your fingers to assess the color, the contour of your nails. The color is pink and the contour is convex. And I'm gonna ask you to hold your hands up, do them like this. We're gonna assess for clubbing. Anything less than 160 degrees means that there is no clubbing. Do them like this, do a heart. Okay, there you go. All right. Means that there's no clubbing. Noted. Let's see. Now I am checking his capillary fill, which is less than 2 seconds. So I'm gonna assess his transverse, anterior and posterior diameter, looking to see if you have a barrel chest, and your transverse anterior and posterior is 2 to 1. Okay. So that looks like. And that's what we're looking for to make sure, hold your head up straight. Okay, there you go. So next I'm going to palpate and check for crepitation, the anterior, the posterior. To make no crepitation is noted. And if we had felt any kind of crepitation, you know, that's a sign of like subcutaneous emphysema. I'm gonna now get my pen light and look at the inside of your mouth, okay?
Okay.
Just to check for color.
All right.
Okay. Your lips they look like they're moist and they have color, no signs of cyanosis. Open up. The mucosal membrane is pink.
I got a question about Stinson, Nurse Stinson.
I'm sorry.
I was just gonna see about it affect you from the smoker, right?
You could have some problems later on if you continue to smoke.
Okay.
Okay. I'm not a doctor, I'm a nursing student. Okay.
Gotcha.
Okay. So what I'm going to do now, I'm going to listen to or auscultate your breath sounds, okay?
Okay.
Your brachial, your bronchiovesicular sounds, and your vesicular sounds. But I will tell you at the end what my findings are, okay?
Okay.
So what I will need for you to do is I will need you to breathe for me, just like you normally would breathe.
Okay.
Okay? But first, I also need to check your chest expansion, like your symmetry.
Okay.
Okay? So I'm gonna find the coastal margins. Breathe for me. Okay? Breathe in. Okay. Good. Okay. And put your arms to your side. Down. Breathe out. Breathe out. Breathe in. Breathe out. His chest expansion is equal and it is symmetrical on both sides. So now I'm going to listen to your lung sounds. Just breathe in and out for me. Okay? Like normal. Breathe in and out. Put your arms down. Okay? Hold it down. Okay. 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 In, yeah. Regular. All right. So turn around to the back for me. Sharon, can you see? Hold your head up. Up, in and out slowly. Okay, so my auscultation, listening to the bronchial sounds, the trachea over the larynx, those sounds were high pitch. They were, inspiration was greater than expiration. Over the bronchiovesicular sounds, over the major bronchi, those sounds were moderate in pitch and in amplitude, and the inspiration was greater than expiration. The vesicular sounds over the peripheral lung fields, those sounds were low and kind of soft in pitch, and inspiration was less than expiration. Okay, so when we auscultate and we listen to the breath sounds, we're actually checking for adventitious sounds, like that will help us to determine like if there's anything going on with your respiratory system, such as wheezing or crackles or anything of that nature that will give us reason to believe that something is going on or something is abnormal. But your breath sounds were clear bilaterally in all areas, in all regions of the lung fields that I auscultated today. So I want to thank you for being my patient today. I appreciate you.
Appreciate you, Miss Stinson.
Thank
Nurse
you.
Stinson.
Thank